Michelle, for you to do it.
Thank you. Wonderful. Thank you, Annette. Okay, so like I said, I'm going to provide some highlights on preventing breast cancer recurrence because I know that is the hot topic. I am very interactive with, my presentations. So if you have questions, please, unmute yourself and, ask a question. I like to make my presentations interactive, whether or not they're online or in person. So, um, for those of you who don't know me, my name is Dr. Janine Grace. I am a PhD microbiologist and molecular biologist. I've been working in cancer research for about 7+ years. My personal connection to this is that essentially I've had family members, especially the elder women in my family, succumb to cancer. So I'm very focused in on prevention, and that's my goal. The purpose of my organization, which is the Cancer Detox, is to make sure that cancer patients and survivors get help with asking the right questions to improve their health care and also start eating the foods and doing the lifestyle habits that have been shown to prevent, a second diagnosis. We're also seeing younger generations at an increased risk of cancer. And I know some of you are talking about, your kids and your grandkids during the intro to this call. What we're seeing now is that, and what scientists are sounding the alarm about, is that, all of these lifestyle factors are starting to affect our children, where they're starting to see that generations that are younger have an increased risk of cancer when they become adults and a higher risk of cancer than their elders. And so all of these factors, such as, eating the standard American diet of processed carbs, ultra processed foods, high intake of meat, lack of sleep, especially with increased use of technology, less exercise, because we have more indoor entertainment and less movement. And one thing that's particularly concerning, especially in 30 and 40-year-olds, has been the high increase of alcohol consumption. And we're also seeing that there's an increased trend of cancer in 30 and 40-year-olds that we never really saw in previous generations. And unfortunately, we're seeing that the pandemic kind of compounded that, because as people were at home and they were, trying to avoid getting COVID, well, unfortunately, some of the things that they were doing in the house, such as increasing their alcohol consumption, has been shown to be causing some detrimental effects on our health. We know that those who are infected, and as it relates to what they're calling early onset cancer diagnoses, are those that are in their 30s and 40s, and they're people that are coming from these high income and middle income countries, such as the U.S., such as the U.K., such as Canada. The cancers that they're seeing that are increasing in these younger people who are less than 50 years of age have been prostate cancer, breast, colon, lung, and bronchial cancers. So that rate is trending up higher. And you may be reading the news reports that are sounding the alarm about this. And, we have to do what we can to start spreading the word about this, especially, when it comes to women and the increased risk of breast cancer. Let's see. Are there any questions so far? So the major risk factors that I always hone in on are, these four here. Being overweight or obese has been shown to increase risk of cancer. High alcohol consumption definitely increases in cancer risk. Poor diet and physical inactivity. So those are the four major risk factors. There's several others that are out there, but these four have the strongest scientific evidence as it relates to increasing the risk of cancer. Okay, so these are some of the basic prevention guidelines that are in the book, but that are all based on science. And it's a compilation from those three medical societies that I just talked about, American Institute for Cancer Research, et cetera, American Cancer Society. So eating plant-based, being physically active, limiting uh, red and processed meat, reducing the alcohol intake, maintaining a healthy weight. And I want to hone in on maintaining a healthy weight, because when I found out and when I read the research that being overweight and obese is linked to about 13 different types of cancers, including breast cancer, that was cause for me to pause, because we all know that unfortunately, in the African American community, we're dealing with an issue of maintaining healthy weight, reducing the levels of obesity in our communities, particularly in women. So, this information in terms of maintaining a healthy weight, that's one thing that a basic conversation with your, general practitioner, your healthcare provider goes a long way, and really asking them and holding them to task to help people start to stay. Limiting fast food, and limiting sugar sweetened beverages. And in the book, I talk a lot about sugar sweetened beverages because there's quite a lot of information out there as it relates to cancer and the intake of sugar sweetened beverages, and it increases the risk of certain cancers. So, limiting that is quite important as well. Specifically, breast cancer prevention guidelines. We know that the global rates right now are 685 deaths per year as it relates to breast cancer, 2.26 million cases. And I believe right now, the last stat that I read, there was about 1 million breast cancer survivors in the US. So there's a large population of women who have survived. Either they've been treated, they are going through treatment, or they have ended treatment for breast cancer. That's what a survivor is considered. So, that's a large number of women. The basic guidelines for preventing are everything that I just presented on the previous slide. Eating vegetables, mostly plant-based meals, eating fiber-rich foods, eating soy-based and phytoestrogen foods. And I'm gonna have a slide particularly on soy about as it relates to preventing breast cancer recurrence. Being physically active, I'm going to talk about that a little bit later as well. Limiting high-fat foods and not drinking alcohol. So the World Cancer Research Fund and the American Institute for Cancer Research both showed a 60% reduction in cancer risk when women were able to follow this particular guideline. And that's quite important. And then also a 71% reduction in cancer. And you can add another 11% reduction in women who adhere to additional guidelines. So that includes the American Cancer Society or other medical society guidelines that are out there. So cancer prevention, breast cancer prevention is quite possible. All right. So that was my last slide. Again, here's my book. You can use your phone or your tablet to scan the QR code. You can find it on Amazon. This is the website up there, bit.ly/cancer prevention book. My website is thecancerdetox.com. You can schedule a call with me at my Calendly, which is on the screen as well. And you can find me on social media at the Cancer Detox. And I have my email and phone number there too. And then the Cancer Prevention Club, I have that as well. That's online instruction with 30 plus videos on cancer prevention. It's only $47 per month through August the 3rd. And then, like I said, I'm starting my 4-week Cancer Survivor Stamina Program. We'll be going to much more detail, Q&A meetings, and that's going to start on October the 9th, and that's $197. You can scan the QR code and or text or email me to sign up. And I'll take any remaining questions that you may have.
Okay, thank you,
I do
Dr.
have one.
Grace.